Hello, assalamu alaikum. Welcome back to my channel. We are on 5.3 box number population health need assessment tool we are going to do now. So those they are really new in my channel, I would like to tell you we are preparing Nclex RN preparation. We are on chapter 5 population health nursing. And guys, I have done my Nclex in first attempt and I am following my tips and tricks what I have done myself to pass Nclex. So one of the most important tip is to read and word by word Saunders book. So we are reading Saunders books and time to time I'm going to upload some practice tests that I have done myself. So guys, to assess myself. So we don't waste time here. We are going to start box 5.3 population health needs assessment tool. That assessment tool is going to be used in USA when you are RN, when you get your license, you are going to work as a nurse in USA. You have to do this assessment tool, but in the exam might be some question will come for that, and this bullet point, this mark we have to read must. So guys, I would like to encourage you to listen. If you cannot watch the video, there is no problem, just listen the video, okay? While you are working, while you are doing something, just use your headphones and try to listen word to word this Nclex Saunders book. It is going to be I could say that it will be really easy for you to listen while instead of watching, because when you are doing something, just listen and focus on the words. So guys, we start. Not all questions listed in this assessment tool we need to be used for the assessment. The nurse needs to make a judgment on appropriate question for each population and needs to ask questions within that list. If appropriate for the client, based on the journal background questions, use the journal background questions as a guide to determine additional questions that should be included in the assessment. It is also important to remember to perform a focused assessment when a client voluntarily seeks care. For example, if a client comes to the healthcare agency complaining of a cough and chills, focus on a respiratory assessment and treatment of this client as priority. So guys, it is related to the health problem as well. So when client come with the specific problem, then we have to focus on specific assessment related to sign and symptoms. So here we are going to initial. The first, introduce yourself and describe your role. It is very important. We all know that we have to introduce ourselves in nursing setting. Example, I would like to ask you some questions so that we have information about your individualized needs. Do I have your permission to ask you some questions? So initial, we introduce ourselves and describe our role. Then they have given example that it is, I would like to ask you some questions so that we have information about your individualized needs. Do I have your permission to ask you some question? Permission we always ask. Then we go to general background questions. So number 1 is, are you comfortable talking to me? What name would you like us to use to address you? These are the questions nurse has to ask on initial assessment. These are general background questions. Everybody know. What is your primary language spoken? Do you speak and understand English? In which language do you wish to communicate? Do you need an interpreter? Do you feel you are able to adequately answer questions regarding your health? What is your age? Is there a specific gender you identify with? What is your ethnicity? Do you have any cultural, religious, or spiritual preferences you would like us to consider in your plan of care? Everyone has their own religious, cultural values. Then we have to focus on that and we have to ask if they need. Do you have any dietary preferences that you would like us to include in your plan of care? Describe your eating patterns in a 24-hour period. So guys, do you exercise? What do you do? And how often? Do you use any remedies when you are sick? Every culture culture, they have some remedies, home remedies that they use. So we have to ask this as well. Let's go for next. What do you do when you are sick? What is your living situation? Where do you live? What do you, where do you who do you live with? Do you have children? Do you have a support system? Would you like to name a support person or emergency contact person? Do you have access to financial resources needs to live? Do you have health insurance? You know, in USA, everyone they do health insurance. So this question is related for that. Do you feel safe at home where you live? Have you been abused within the last 12 months? Do you encounter crime or violence in your life? Is anyone hurting you physically or emotionally or in any other way? Have you ever been or are you being bullied? Then, do you smoke, drink, do you smoke, drink alcohol, or use any type of drug? Do you have or need a healthcare proxy? Do you have an advance directive? If not, would you like more information about this? When was the last time you sought healthcare? For what reason? Do you have any fears about seeing your provider? Do you currently or have you ever had an infectious disease? Have you been exposed to anyone with an infection disease? If so, how was this exposure treated? Have you ever been tested for COVID 19 or tested for immunity? Have you had the recommended COVID vaccine? Have you traveled outside of the country recently? Are you up to date on immunization? When was your last influenza vaccine? Have you ever been vaccinated for pneumonia? If so, when? Do you have a history of mental health problems? Have you ever had feelings of committed suicide? If so, do you have these feelings now? Do you have a plan? Are you a veteran or member of the military? Do you have any chronic illness, disability, or other past medical history? Have you ever been incarcerated? Are you an immigrant or refugee? So, guys, this was the box number 5.3 Population Health Need Assessment Tool. We are reading chapter number 5 Professional Standards. This is the chapter number 5 Population Health Nursing Professional Standards. So just let me tell you guys, we are not wasting here time. When you read, when you listen this all, you will get idea what is the basic needs assessment tool when you have a client, and when the client come in hospital, what kind of assessment tool you have to use. Might be it comes in the test, so you remember this all. We are just reading Saunders edition 9 word to word, so you will not miss anything. You will have the background, you will have the grip of foundation of your test. When you do practice tests, you will open your mind window, and then you will have idea of all basic concept and foundation. It will help you, I'm telling you, it will help you to pass your exam. Just stay motivated, stay tuned with me. I'm going to do all Saunders book word to word how I did myself, and I'm going to upload all practice tests what I have done before going exam. Stay tuned with me guys, then bye for now and see you in the next video.